Cubital tunnel syndrome, ulnar nerve subluxation. The anatomy consists of the humerus, radius ulna, medial epicondyle, olecranon process, ulnar groove, ulnar nerve, and Osborn's fascia. The pathology of a cubital tunnel syndrome injury is a compression or stretching of the ulnar nerve, as well as neuropathy, and translation anteriorly across the medial epicondyle is an ulnar nerve subluxation. The mechanism of injury is trauma to the medial elbow, compressing the nerve for cubital tunnel syndrome, and partial dislocation and relocation of the ulnar nerve is subluxation. And here's a little video to kind of show you exactly what that looks like, since there's not really a picture. Signs and symptoms include numbness, tingling, paresthesia, pain, difficulty moving during daily activities of living, muscle weakness, and a quote-unquote snap that is felt or heard. Differential diagnosis include medial epicondylitis, or golfer's elbow, and snapping tricep syndrome. The special tests are for the cubital tunnel syndrome, which are the elbow flexion tests and Tinel's sign. You can go to YouTube and check out PhysioTutor's videos on those two tests. There's no Mulligan technique for this particular injury. The nerve glides, the first one is a elbow flexion with wrist extension. Your shoulders are abducted, your hand is pronated, and you take your elbow from extension to flexion, bringing your hand to your ear. The second one is elbow flexion in front of the body, with your shoulders flexed, fingers extended, and your elbow goes from extension to flexion. The next one is head tilt. Your shoulders abducted, your hand is supinated, your head is laterally flexed to the opposite side, and your fingers can be extended to increase the stretch. The last one is Birdman or OK. Your shoulders abducted, your first and second phalange are compressed to make an OK sign, and you take your elbow from extension to flexion, and midway you rotate your wrist to put the quote-unquote OK sign over your eye. And here is Ask Dr. Joe to explain furthermore nerve glides for the ulnar nerve.
Is the Birdman. And if you can do that, you probably don't have a nerve issue. So, basically making the OK sign. This one, I would almost say borderline's a stretch, so be very careful with it. You want your elbow bent, you want to make an OK sign, and you're just going to turn back, taking your pinky behind you. So you don't have to go over your face like me. But even right here, because I've had shoulder issues in the past, I can feel it going through my pinky. So if you get here and you feel it, just go to there. Don't push that nerve tingling. But if you can get a little bit further back each time without it being painful, then do that. But you really want to extend that wrist or bend it back as you come back for the proper tea drinking position where your pinky goes back. But remember, just one is going to be, you're holding your arm straight down with your elbow straight, your wrist is going to be flexed in, and your fingers are going to be flexed in. So with this one, again, some people might be feeling the nerve right here with that. So if you're feeling that, maybe you just do this in a couple times. But if you're not feeling that a whole lot, what you're going to do is, as you do the hand movement, you're going to side bend your head away. And what you're doing is you're just turning your arm and your wrist out and back a little bit. So you're extending that arm back as you turn it out. And while you do that, you're side bending and then coming back in. So again, if your nerve is really irritated, you're probably going to feel it through that pinky area. So if you're feeling it a lot, don't go back a lot. Just come in. Sorry, that wasn't quite a side bend. But just side bend with your head, go back. Last one I'm going to show you is a little bit more interesting. It's kind of like the Birdman going back, but you're just doing it almost, I call it the carrying the tray. So what you're going to do this time is you're going to put your hand outwards, but you're going to side bend your head towards that side. So you're taking a little bit of slack off of that nerve. So you're coming this way, and then you're still keeping your head side bend. You're going to bend that elbow and then bend back your wrist into extension with your hands flex. So then you're holding a tray if you have ever done restaurant work, which I haven't. I'm not coordinated enough for that. But then going back down and then coming back up. But see, I'm keeping that side bend the whole time because I don't want to overstress that nerve. So I'm taking the slack off of it. Here and then back down. So everything's straight, fingers out, bend that elbow, bend that wrist, keep those fingers.
Predisposing factors include bone spurs, arthritis, and previous fractures and/or dislocations. Management and treatment include rest, elbow pad, immobilization for 2 to 6 weeks, and range of motions ROM exercises. Referral and immobilization, surgery if necessary, which is unlikely, but physical therapy, a broad arm sling, a foam elbow brace, or a night splint, which is displayed to the right. Prevention of this injury can be simply done by proper warm-up and stretching, refrain from resting on elbows, keeping arms strong and flexible, and avoid excessive elbow flexion. The PICOT analysis was a 30-year-old Asian man presented with severe radiating pain from the elbow to the forearm, following a fall on an outstretched hand. He had swelling and severe tenderness at the posterior medial aspect of the elbow, pain aggravated with elbow flexion beyond 80 degrees. The population was a 31-year-old Asian man. What happened was a dynamic ultrasound was taking place of the left elbow. There was no comparison, and the outcome ended up being a broad arm sling for 3 weeks at 45 degrees, and no time was recorded.